If you could bottle her up and give an Esther to every single hospital in the world, the world would be a better place. I'm Nicole.
And I am Jeremy.
We are Archie's parents, and we were NICU parents. When we were lucky enough to fall pregnant, went to the GP, it was mentioned straight away that because of my high blood pressure, I was going to be high risk for preeclampsia, and also that I could also be high risk for gestational diabetes, and I got both of those in the end. We were very, very lucky that our GP very kindly got us onto the midwifery group at the Royal. It was a Monday, and I'd been to work that day and had just a routine appointment to check with the gestational diabetes and blood pressure, etc. And around 3 o'clock, everything went wrong. Suddenly, my face started to swell. The whole experience was so surreal. I've gone from being in this big room by myself with one midwife to there suddenly being 10 people in the room. Someone said, okay, we kind of need you to sign this emergency form. You're going to have an emergency C-section. Text Jeremy and said, I think you need to come in. I think we're having a baby. Dr. Shan came in and spoke to us really clearly and just said, between the preeclampsia coming in and his heart rate, it's safer for us to actually get the baby out now.
It was all very intense, but we felt in really good hands because we had so much support around at the hospital, everyone telling us what we needed to know and keeping us calm, and yeah, it was all very good.
So when I first saw Archie in the NICU, I remember coming downstairs, I was in the wheelchair, he wheeled me down, we went in, and he just looked so tiny. He looked so little, and he had a respirator on his back. Oh God, it does look a lot. It's machines and it's tubes. You don't really get a moment to let panic sit in because there are several nurses around you all the time to help you, to talk you through everything. So you don't really have a moment to be worried.
Yum, yum, yum.
Honestly, it was we had a great experience. They kept telling us he was progressing really well. There was nothing wrong with him. He's just a little baby. So he was progressing from level 3 to level 2 really quickly.
Archie was nursed in level 2 of the nursery. He needed it as long as he maintained his body temperature by himself. So we tried once to take him out from a crib to a cot, but he was too small and too cold. He was also on IV infusion, so we needed IV pumps. He was on antibiotics, he needed a syringe driver. So it's a complex, lots of medical equipment he needed for the first couple of weeks for survival. My name is Esther Jossa. I'm a clinical nurse specialist in the Royal Hospital for Women Newborn Care Centre and the coordinator of the Hospital in a Home program. I met Nicole, Jeremy and Archie day 2 of Archie's life. Nicole looked a bit uncomfortable after the surgery. It was a little bit unknown, but she just enjoyed every second of it being with Archie.
I felt so safe and so supported by each one of these people individually in each of the interactions that we've had. They love babies and you can see how much they love them. Well, Esther the Bester, she makes what can be quite a stressful situation really calm. She came over to us and said, guys, you live nearby, don't you? And she started explaining, we have this program called Hospital in the Home. Would you like to take your baby home? Yes.
The program is providing support and education for parents and their babies and the families. These babies are going home early, who are eligible for the program. We are providing all the equipment needed for that, and they are doing the job at home.
You're basically sent home with a hospital with you. You've got scales and you've got tubes and you've got syringes of all different shapes and sizes. You basically come home with a hospital, everything you need in the home.
One of the first nights we came home, when we had to test the feeding tube, it wasn't working, and it's 1 a.m. in the morning and give up the NICU a call. They talk you through all the different things.
So Nicole's complex medical conditions kind of preempted that we need a bit more care for Archie, potentially. So one of them was mental health issues. And I think in this situation, when it's very stressful for the babies and the mothers, I think that was one of the crucial points our care concentrated on, to make sure that Nicole's mental health is absolutely spot on before she took home Archie.
Mental health is prevalent in my family, and I've been through depression before, and I was incredibly scared of postnatal or even bipolar. So not only did we have Esther providing kind of nursing and medical support for Archie, but we have also had a mental health midwife, and she comes kind of every couple of weeks and is on the phone to me every week to make sure that I'm okay. All of this is a service that's provided through the hospital.
I was admiring actually Nicole, because she was very upfront about her condition, and she was very much seeking help actively to make sure that her mental health is supported enough. It was fantastic to see.
After this experience, people we met, the experience we had, the care we had for us, if we could replicate, we would 100% just do it. We wouldn't change anything. It was just perfect.
There needs to be more Esthers in the world. There needs to be more HIT programs. It's completely invaluable, and she loves it.
The most amazing part of my job is to see the parents grow, and their confidence, their agility, their understanding of their babies, and the whole family as a family structure come together. It's such a privilege to be in their life, in their very stressful and very significant part of their life. I think it's the best job ever. I really enjoy it.